There is an excellent new treatment modality that we have available at our clinic. We've had it for over a year now, and it's called photobiomodulation. This is where we use photons to interact with our biologic tissues. They have effects in the mitochondria, directly in the DNA, the cell membranes, the interstitial space. They increase growth factor release. They cause direct genetic transcription and translation. They improve mitochondrial energy production. They modulate inflammation. It's really amazing. Now in my practice, I've been using this a lot for autoimmunity, ankylosing spondylitis, rheumatoid arthritis, lupus. It's fantastic. I mean, you can also use it for psoriasis. You can use them for joint pain of just normal osteoarthritis and knees. And there's great evidence. You can go on PubMed and look up photobiomodulation and whatever concern that you have, and you'll find perhaps some research depending on what your concern is. Definitely in the things that I've already mentioned, there's good research. And one of the things I'm most excited about is its usage in autoimmune thyroiditis, so in Hashimoto's or in Graves'. This is where the body's made antibodies to attack the thyroid. It's a mistake. Now, most people who have this end up having difficulty with losing weight. Even though they're on thyroid hormone and their TSH is normal, they still have trouble losing weight. So we do semaglutide at our office. I personally think we're one of the best offices in the country as far as price and service. So if you're interested in that, give us a call. We can get you set up. We ship to all 50 states. But what I notice is that 90% of the people who come to me for semaglutide have hypothyroidism. And that can't be a coincidence. So in these studies looking at using this laser light, photobiomodulation, to treat autoimmune thyroiditis, what they found is that it varied from 25 to 40% of participants no longer needed to use thyroid medication, and an even greater percentage decreased their dependence upon their thyroid medication. One of the studies also found that without there being any other intervention, no education on weight loss or diet or anything like that, people lost an average of 5 pounds in this 6-month follow-up period. And it certainly makes sense. Most people who develop hypothyroidism notice that their weight gain is closely associated with the development of that. So normalizing the thyroid would improve the weight. Just in theory, it makes a lot of sense. And we have some initial evidence to really support that. So this is working, this light is working somehow to decrease the immune system's reactivity to self-antigen. Like, how exactly is it doing that? It's not mapped out yet, but it's almost like it's shedding light on a process that's happening that's not appropriate, right? It's literally like it's shining light on it, and maybe the body can just see more clearly what's happening. It'd be one way to kind of poetically represent it. So if you're dealing with hypothyroidism, you should look into this research for photobiomodulation and autoimmune thyroiditis. You can just go to pubmed.org, type that into the search, and you'll find studies. If you want to work with us, we'd love to work with you. Otherwise, there are a lot of different practices around the country that will have the sort of laser light that's necessary. The one that I'm most familiar with and makes the most sense to me is the 1064 nanometer wavelength light. Our device is the Photona. Now, it won't be the only device out there that has this capability, but from my experience, it's the best one that I've seen. Thanks for watching. Be sure to subscribe, like this video, check out the other ones too.